Okay, welcome, Pahrump. I'm Dr. Michael Reiner, your host of this show, The Independent Doctors of Pahrump. And tonight, this is, and I hesitate to say it's a live show, but it is. So the call-in number is 727-8750. That should be at the bottom of your screen for those viewers that do and wish to call in. I certainly encourage that. It always makes for a lively show, and certainly I like to answer your questions as much as possible. Because we've had such a nice caller response, I've kind of delayed in putting together packaged information for you, such as the way of a PowerPoint presentation and things of that nature. This is just my way of saying, I appreciate your calls and your questions about any topic related medically, even if it's medical and political. Those are often things that we enjoy discussing. I've never held back on some of my political views, and that kind of ties into this. One of the things that I've been hearing a lot about lately is the shortage of physicians, the complaints of waits and things of that nature. To get in to see the doctor, get in to see me, get in to see some of the other physicians in town, and you can probably expect more and more of these delays, to be a problem, just because of the shortage of physicians and the newness of Obamacare and the amount of people that are in the system. So we have Louis on the phone. Louis?
Try one more time.
Okay, waiting for Louis on the phone. We tested this stuff right before we came online, and it sounded good. So, Louis.
Hello, Doc. How are you? This is Louis DeCanio. How you doing tonight?
Great. How are you doing, Louis? What can I do for you?
I'm doing fine. Listen, I got a problem with my shoulder now. I don't know what I did or what I pulled or whatever, but it's been sore for quite a while, and I have like a tough time like reaching over my head and stuff, like raising my arm. And now, I take like aspirin and stuff like that to like relieve the pain, but it seems like it's been going on for quite a while, though. It don't seem to go away. Is there something you could recommend that will make it go away?
Well, the usual issue is being able to basically lift your arm past that 90 degrees. This is usually the point of where above this becomes painful, and then that would be the definition of a shoulder impingement syndrome, or the impingement of being able to elevate your shoulder. And that a lot of people want to term that rotator cuff, but that's not really what rotator cuff is. Rotator cuff is a complex injury. The shoulder is a very complex joint where a lot of muscles and tendons come together to create. There is actually a synovial joint tissue, but a lot of the supporting tissues come from the back muscles, the scapula, the deltoids, the basically you've got a lot of the muscles, the biceps and the triceps. They all come together at the shoulder and interact in some way. Usually, we as animals, and I say as animals, humans, basically we were not meant to do any work above our head. We were meant to do everything below the shoulders, and then that creates a fraying and a wear on those particular ligaments. So over-the-counter products, if you take a lot of ibuprofen, it may upset your stomach. It may cause some problems in there. Physical therapy sometimes can be very helpful if you get in with the right person that understands the mechanics of the shoulder. One of the things that I prescribe a lot of, even though it's not indicated for it because it came out with just the indication for knees and hands, was Voltaren gel. I particularly like that product because it's a non-steroidal anti-inflammatory gel that the idea behind it is when you take Motrin, let's say 600, 800, 200, whatever the dosage is, you're going to get 100% in your stomach. And then there's a thing called bioavailability, which means so much of that's going to get into your intestinal tract and be absorbed, and then it goes through your liver where it gets degraded, and you're going to get a small percentage out your body where it causes some side effects in your stomach and your kidneys and things of that nature. when you use topical Voltaren gel, which is Voltaren or diphenyl sodium, you're going to get 100% on your skin as long as you let it soak in for 15 minutes, but the rest of it is going to penetrate into the surrounding tissues and into the joint, and you're going to get a distribution of 4% throughout your body. Now, what actually gets into your skin and gets into the joint is probably going to be very debatable. But that, in combination with rest and the appropriate physical therapy, can be very helpful in using or helping to alleviate the pain in that particular joint. The other thing is, I don't know who your provider is in town, but an X-ray, maybe even an MRI, may be very helpful to rule out other problems that could be in the bony, in the supporting structures of the shoulder. And that's how you would initially help the diagnosis and then prescribe a conservative treatment. And then obviously of last resort would be, the possibility of cortisone injections, which I don't like, and the possibility of surgery if nothing else fails. But I would always keep that as a last resort.
I see. Well, okay. Thank you very much for your input, Doc. And like I said, I'll be putting stuff on my shoulder to hopefully it'll go away without any kind of surgery or anything else. So thank you very much, Doc. Thank you. I appreciate it.
Yeah, you're welcome, Louis. Thanks for the call. I appreciate that. And that brings up a really interesting thing. Rotator cuff. One of the joints that tends to give people a lot of trouble in the shoulder is this AC joint, which is right here. It's where the chromium, which is a bone that from your shoulder comes over, and the clavicle joint. It's one of these, it's not really a joint, but they call it an AC joint, a chromium clavicular joint. It's held together by cartilage, and there are separation injuries that can take place in that. But those people that played football, those people that pound their shoulder into the ground are going to suffer a lot of AC joint arthritis, as well as just wear and tear on that. And so that's a real common problem for usually pain, what we call adduction, bringing your arm in, ADD, and then abduction, bringing your shoulder out, are the medical terms for that. Ray is on the phone.
Yeah, Ray the Flagman here. How's it going, Doc?
Good to hear from you. How are you doing?
I'm glad you got the speakers going and everything. It's a wonderful night.
Yeah.
Yeah. Years ago, I went to the dentist, and Novocaine shots used to be horrible. I mean, they would give it to you, and you could feel that needle going in. I went to one dentist, I didn't feel the pain, and I asked him why. And he said, because he pinches my cheek on the other side and distracts me with a different kind of pain. Mm-hmm. Now, I've heard rumors the body can only, recognize one pain at a time, different parts of the body. Is that correct, or is that just an old wives' tale? And the second thing is, what is phantom pain? Because I had a friend who had a leg amputated in Korea, and he said he felt like the leg was still on. Mm-hmm. So if you could explain that on the air, and I'll listen on the air and let somebody else call in.
Okay, yeah, thanks. Those are good questions. Okay, so let's talk about the idea of perception of one particular pain at a time. That is probably, and I don't know the exact answer to that, but it certainly is a very true statement, and I'll try and explain why, and I'm going to kind of go through my mental thinking on that. Pain, which is a combination of, there are some limbic systems in our body which are basically fight or flight. They're very rudimentary neurologic impulses that we can't avoid in stressful situations. They're left over from when we were in our development. And I know there are some people that don't like that particular thought of where we came from and who we might have evolved from, evolution, but taking that out of the question, the limbic structure is basically flight or flight. Then everything above the limbic system, which sits at the base of the cortex of the brain, everything up here is higher level thinking. That's what separates us from a lot of the other mammals and a lot of the animals. We're able to reason, think, and things of that nature. So all of those ascending fibers, pain fibers, basically ascend through the brainstem, through the higher cortex into the neocortex and the higher level of thinking, which is how we react to and how we basically perceive and how we deal with pain. So, and it's true that our subconscious mind is processing a lot of information, and so, but our subconscious mind is not on the surface. It doesn't represent what we say, what we do, whether we wince, cry, however we respond to pain. That is a learned type of phenomenon. So, and obviously you lived with the fact that that is one of the ways to take away the pain. Like, you know, there's a joke about you know, I got a really bad headache, and I said, okay, well, let me hit you in the shin with a steel pipe, and we'll make you forget about that headache pain. And that certainly is true. And if you can't really perceive multi-level or different types of pain from different inputs because they're all ascending through basically the same fibers. And that lies some of the interesting ways that we treat pain that are non-opioid based. I know I've discussed methadone on this channel before, about how it basically covers all of the ascending pain fibers. But if we look at the medications that are out today to treat pain, we see that a lot of them have basis in drugs like Cymbalta, which is initially was a antidepressant, but found that it actually modified ascending pain fibers. Anti-inflammatories work at the site of the pain, reducing inflammation, therefore reducing those fibers going up there. So listen, we got to take a break, but it's a very interesting subject, and I'm going to go into the next segment on that, and a lot of good stuff from that. So Ray, thanks for calling. I'm going to finish that up after the break. Thanks. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.